there are doctors who come to enjoy a healthy future.
Can childhood leukemia be treated like normal people?
All our tumors now take 5 years of disease-free survival as a cure. Because after the patient has a tumor, you're hard to keep track of tracking him to the last developed country maybe by decade. Because 5 years later, what about all these tumors? If you can survive for 5 years, there was no recurrence. So what actually, the chance of recurrence is less than 5%. That means that at least 95% of the patients are cured. We consider it a cure. So we don't use the word cure. However, our default assumption is that all tumors are based on 5 years of disease-free survival as a measure. And the truth is, this cure of childhood, leukemia, marriage, school, having children, these are all fine. That is to say, we try to avoid the existing treatments as before some radiation, and it causes a second tumor, is to avoid these toxic side effects as much as possible, whether it is short-term or long-term toxic side effects. What about the cured patient? The quality of life is also good. That is to say, it is not much different from normal people.
Expert advice. After childhood leukemia is cured, later, you can get married and go to school normally. They have offspring. It's not much different from normal people. In addition, short-term and long-term side effects should be avoided as much as possible during treatment. Cancer cure measures 5 years of disease-free survival. If leukemia can survive up to 5 years after treatment, there was no recurrence. The recurrence probability is less than 5%.